Very good morning to you. Today we are on 11th of April, and what we thought is that we'll go ahead with the part 4 of the video shoot for an educational video for public interest in this, how do we deal with cancer patients during this COVID-19 pandemic. Okay, so let's get into how do you see your OP cases. We cannot really stop OP. Patients are taking their trouble to come, but yes, we need to go along with the government and both local and central government how to deal with cancer patients during this COVID-19 pandemic. So as a doctor, what you should do, we need to be very alert and careful. Have a suspect that every patient who is coming into the OPD is a suspect COVID patient. Maybe positive, maybe negative, but we need to take all precautions. N95 masks is very, very needed, particularly when you are going for immunocompromised patients, particularly diabetic, hypertensive, renal on dialysis, COPD, cardiac, even cancer patients are all immunocompromised. Don't forget again N95 mask. Have your gloves in. You have to, after nicely scrubbing for 2 minutes either in an alcohol or in a soap solution, you are expected to put in your gloves. Don't forget your personal protective gown, whatever is available, put it around your neck. It should be up to the sleeves, and try to have shoes if possible there. If possible, goggles. If not, be very careful to do the OP in a different manner. See to that you clean the knobs of the door. The table is wiped in front of you, the chair handles, the bed where you are using, and as soon as one patient is over, try to change the sheet, the stool, the handles, knobs should be cleaned with alcohol before you start the OPD. Next point, as soon as you come into the OPD, try avoid touching places here and there, fiddling with the computer, the phone, this thing. Try to keep your hands together and when you examine patient or you talk to the patient. Next is, triage your OPDs. Don't call everybody to come. Only the people who needs treatment today has to be there in the OPD. And avoid lot of attenders, minimum attenders to be there, minimum waiting time. You yourself start seeing the cases without avoiding much time. Call the patient inside, and everybody has to be in masks, whether they're sitting outside or inside your room. Make them sit in the stool. Keep at least a 1 meter distance between you and him. Avoid using the stethoscope until and unless it's really needed. Yes, use the stethoscope. If the patient needs lying down, put it on a bed, but the sheet has to be changed and we have to spray alcohol immediately after the bed as soon as they finish the procedure. Use electronic data in order to write. Use a single pen. Avoid too much fiddling with the file of the patient. Just write on a new prescription and hand it over to the patient at that point of time. And as early as possible finish the consultation. Have limited hours in the consultation. And as a doctor, we also tell everybody that avoid wearing jewelry, avoid wearing neck pieces, avoid rings, avoid bangles. Yes, what you can wear, but it is better not to wear. Better to be dressed in simple, no hanging and dangling things, because it touches with the clothes, things inside the OPD, and that will be a potential source for the virus to be carried. These are things, and once your OP, you are done with that, and prioritize home to be seen. Triage the patients in the OPD. Do not order for unnecessary blood tests and gas scans now. If they are in for chemotherapy, quick admission, give the drug and should be discharged on the same day. Next, what you do once you are done, wash your hands with soap or with alcohol. Clean all your belongings. Most probably it is going to be a pen, the car key and the mobile, which has to be, and the watch and the stethoscope. Put alcohol before you go out of the room and get into the car. The car door knob has to be also cleaned with alcohol. And once you are at home, remember, inform that you are coming home. Leave most of your things outside the doors and has to be sprayed before you enter. Remember, there are other people in the house with your living. Directly straight go to the bathroom. Remove all the clothes and put it in a bucket with soap water. Put it for soaping. You should take complete head bath and change into the new clothes. And all your phone, car keys, bag, stethoscope has to be sterilized with alcohol and before you get into your normal things. So these are some of the few points which helps us to do an OPD, because you cannot avoid your seeing your patients in this pandemic. Yes, patients are there, people are traveling, hospital services are open, yes, but you have to prioritize, you have to go to see what is best for the patient and do, and also I'll follow the national and the central guidelines for management of COVID patient. Remember, every patient or everybody around you is a suspect COVID, and take care and then proceed. And thank you very much. I sign off today. Today is the 4th day of our video. I tell everybody, stay safe, stay connected, and you can follow up us in Facebook, LinkedIn and YouTube channels to see much more videos. Thank you so much.